Baltimore County Executive Johnny Olszewski, Baltimore County Police Chief Melissa Hyatt, Colonel Jerry Jones, the Superintendent of the Maryland State Police, and Marshall Weston, the President and CEO of the Restaurant Association of Maryland. Last week I led a productive call with all the county leaders from all 24 jurisdictions and another one with all of our municipal leaders. And we continue to expand our outreach and communication with local officials across the state. Earlier today, I joined, just before coming down here, joined another teleconference with members of the White House Coronavirus Task Force to discuss progress on Operation Warp Speed and vaccine development and distribution. They were all frank conversations about the challenges we face as the new surge of COVID-19 continues to rage across the country. Unfortunately, or fortunately, Maryland is still much better prepared than most states to withstand this surge, particularly when it comes to testing. On Saturday, we reported a new daily high of 51,510 tests completed. The cornerstone of our testing strategy has been and continues to be our lab genomics test from South Korea. We've used 394,545 of the lab genomics tests, including another 16,530 since Friday. We have more than 230 testing sites available across the state, and our COVID-19 testing task force continues to expand operating hours and add staff at community-based sites to respond to the rapidly increasing demand. This exponential increase in our testing capability has made it clear that there is widespread community transmission in every corner of our state. Maryland has now had 19 straight days with more than 1,000 new cases of the virus, including another 1,658 new cases in just the past 24 hours. There were over 142,000 new cases across the U.S. yesterday, the 20th straight day that new cases have topped the 100,000 mark. Today, Maryland's 7-day positivity rate is 6.88%. Our COVID hospitalizations have increased by 80% over the past 2 weeks. As of today, 1,276 COVID patients are currently hospitalized in Maryland. 289 patients are currently in ICU, which is the highest level since June 15th. Even with the additional 6,000 beds that we provided for in our hospital surge plan, we have hospitals in Western Maryland which are already at their capacity limit, and 29 hospitals in Maryland that are at more than 90% of their capacity. Maryland is in the red zone for the number of cases per 100,000, and our average case rate has risen to 38.3, which is nearly a 36% increase in just the last week. U.S. hospitalizations set a record for the 13th straight day at more than 83,000, and the virus has now taken the lives of 4,293 Marylanders and over 256,000 Americans. To address the rapidly rising cases and hospitalizations, we have taken additional new actions to keep our hospitals from overflowing and to stop more Marylanders from dying. With contact tracing data showing a large uptick in new cases among Marylanders who have recently been exposed while dining out or shopping, capacity for bars and restaurants, retail businesses, and other establishments and facilities was rolled back to stage 2, which means 50% capacity. And based on reports that compliance with public health protocols drops dramatically later in the evening, all establishments statewide where food and/or alcohol is served are required to close by 10 o'clock p.m., with the exception of takeout and delivery of food and beverages. Because our contact tracing data continue to show that gatherings are a big cause of the spread, a public health advisory was issued to discourage any indoor gatherings of 25 people or more. and an expanded travel advisory, strongly advising Marylanders against any non-essential out-of-state travel to states with high positivity rates. Fortunately, many people are following that advice. A survey by AAA found that nearly 90% of Marylanders are not planning to travel for the Thanksgiving holiday. Limitations have been reinstated regarding visitation of hospitals and nursing homes. Maryland's statewide masking order remains in effect, which requires the wearing of masks or face coverings at any public indoor facility, including retail establishments, fitness centers, grocery stores, pharmacies, personal services establishments, in the public spaces of all public facilities and private businesses across the state, as well as when using public transportation. Masks are also required at all outdoor public areas whenever it is not possible to maintain physical distancing. All of these important actions are critically important to slow the spread of the virus and to fight this COVID surge. However, these important safety measures and public health orders are only effective if they are being followed and enforced. The vast majority of Marylanders and our small businesses in the state are doing the right thing and are going above and beyond to keep safe and to help us fight the virus. But as COVID fatigue has set in, some individuals and businesses have unfortunately started to become more lax at the very worst part of the pandemic. Recently, Anne Arundel County Police made multiple arrests in a horrific case at the Cold Stone Creamery in Edgewater, where patrons refusing to wear masks brutally assaulted 2 store employees. They will be prosecuted to the fullest extent of the law. I know that there is growing frustration that we're still fighting this virus, and many people are struggling emotionally and financially. And this is causing a great deal of stress for nearly everyone. But following the public health directives is the only way that we will be able to stop this virus, to keep Maryland open for business, to keep our hospitals from overflowing, which is why it is absolutely critical that they must be followed. Businesses and individuals who blatantly violate the public health orders and refuse to follow state law are not only willfully endangering themselves, but their family, friends, and neighbors as well. The Wednesday before Thanksgiving is often a night where kids come home from college. They go out to bars to drink and socialize before then celebrating the holiday, sometimes with older family members. I cannot stress enough how reckless that behavior would be this year. 57% of all the complaints that have been registered across the state have been about compliance issues at restaurants, bars, and retail businesses. Especially now, it is critically important that we stay vigilant in this fight. We can't let a few bad actors spoil it for the others who have been doing such a great job. We cannot afford to undo all of the progress that we have made together in this war against the virus. This morning I participated in the 17th annual Maryland Remembers ceremony, which pays tribute to those Marylanders who tragically lost their lives at the hands of a drunk or drugged driver. As tragic as drunk driving is, far more people in Maryland have been killed by COVID-19 this year than by traffic accidents and drunk driving. Today, we are announcing that in addition to our traditional statewide efforts, ramping up drunk driving patrols and enforcement ahead of the Thanksgiving holiday, we are also launching a wide-scale, all-hands-on-deck compliance, education, and enforcement operation. The Maryland State Police is expanding its COVID-19 Compliance and Coordination Center and deploying high-visibility compliance units across the state. Additional state troopers will be assigned in every single county to work in partnership with county leaders, county health departments, liquor boards, licensing and permitting departments, as well as municipal and county law enforcement agencies to investigate any reports of violations of state law. Beginning on Thanksgiving Eve, these high visibility compliance units will be detailed to popular downtown areas, Main Street areas, in places including Bel Air, Towson, Salisbury, Silver Spring, Baltimore City, and to other spots around the state. State troopers will support local authorities with compliance checks with a focus on educating the public about existing orders, protocols, and priorities to prevent super spreading events and to insist in enforcement compliance when actions are necessary. State Police Superintendent Colonel Jerry Jones has reached out to all state and local law enforcement entities in order to mobilize and join forces in this joint operation in order to increase visibility, education, and enforcement of all existing directives, orders, and laws. Effective immediately, MSP will be operating a 24/7 phone line and email address to support local compliance teams in the field with any questions regarding orders and enforcement. The Maryland State Police is also ramping up their COVID prevention hotline, where members of the public can call to report unsafe facilities and activities or violations of public health orders. Marylanders who see unlawful behavior are encouraged to report it by calling 833-979-2266 or by sending an email to prevent.covid@maryland.gov. We remain fully committed to assisting and supporting our county and municipal governments in their efforts to enforce COVID restrictions and orders. And I want to commend those jurisdictions that have already ramped up their enforcement efforts. The Frederick County Police Department has increased staffing and will be working in partnership with the Frederick County Liquor Board, the Office of the State Fire Marshal, and their local health department to conduct compliance checks starting on Thanksgiving Eve. And I particularly want to thank the efforts by Baltimore County Executive Olszewski. They formed a 30-member social distancing task force to ensure that businesses are informed of and complying with masking, distancing, capacity restrictions. And the unit has already inspected more than 5,200 establishments. This is a great example for other counties across the state. And I want to thank you, Mr. County Executive, and Chief Hyatt for joining us here this afternoon. The heightened visibility operation that we're launching today isn't just about enforcement, but it's about education on how to keep businesses safely open and to educate the public on how to stay safe and save lives. At 5:00 p.m. on Wednesday, the Maryland Emergency Management Agency will be sending a wireless emergency alert to cell phones across the state to remind Marylanders of critical COVID-19 prevention measures and to provide information about state and local law enforcement actions. It is only the second time that we have ever utilized this warning system during the entire time that I've been governor. We are also launching a unified statewide public health campaign with public service announcements that will be running on local television and radio to remind the people of Maryland that while we have been fighting this virus for what seems like forever, and even though a vaccine is on the way, we can all make a huge life-saving difference if we do the simple things, if we keep on wearing our masks, washing our hands, and keeping our distance. Now more than ever, we must keep doing whatever it takes to slow the spread of COVID-19. And finally, with Thanksgiving just a few days away, I want to remind Marylanders that both federal and state officials are strongly advising against holiday travel and advising that celebrating is safer if limited to members of your immediate household. We want all of our families across the state to enjoy the holidays, but we want them to do it in a safe way. While the way we celebrate this year may be different, we still have so much to be thankful for. I'm thankful for the doctors, nurses, first responders, and all of our frontline healthcare heroes who have been working around the clock, day in and day out, with little sleep to keep this virus at bay and to save lives. I'm thankful for our scientists who are working tirelessly on vaccines and innovative therapeutics. And most of all, I'm thankful for the continued strength and resilience of the people of our great state, the thousands of Marylanders who have made sacrifices to keep each other safe, who are donating food to local food banks, checking on their neighbors, supporting their favorite local restaurants by ordering takeout and delivery, and by supporting each other during this difficult time. Thank you for standing together in this fight and for staying Maryland strong. Now at this time, I'm going to turn it over to the county executive to discuss the social distancing task force and his increased education and enforcement efforts in Baltimore County.
Thank you, Governor, and good afternoon. It is indeed an honor to be here with you, Governor Hogan, Superintendent Jones, and Marshall Weston from the Maryland Restaurant Association. I'm also pleased to be here alongside Baltimore County's Police Chief, Melissa Hyatt, who in my opinion is the finest police chief in the state of Maryland. Governor, I first want to thank you for the $3 million of eviction prevention funding that you announced this morning. I'm proud that our staff in Baltimore County have put together a significant eviction prevention program that helps ensure our residents avoid losing their homes, and we're grateful for the additional support that you've given us. It will go a long way to bolstering those efforts. I joined Governor Hogan here today because I want our residents to hear us loud and clear. The situation is dire. Baltimore County cases have skyrocketed, more than quadrupling in the last month. For the past 19 days in a row, we've recorded record cases every single day. We now have more COVID hospitalizations than we have at any point during the pandemic. Over the past month, our positivity rate has increased by more than 185%. But Baltimore County's problems are not unique to our jurisdiction. We see the same disturbing trends across the state, from Western Maryland to the Eastern Shore and everywhere in between. The science tells us that we face a double whammy. Not only are we spending more time indoors, but we're also more likely to catch the virus there. That means that now more than ever, the governor is right. We have to take this virus seriously. I know that many of our residents have. They've hunkered down, they've avoided large gatherings, they've worn their masks. To those individuals, I say thank you, and please continue staying vigilant. Keep doing the things to keep yourselves safe, to keep your loved ones safe, to keep perfect strangers safe. Especially as we enter this holiday season, these brave actions are needed now more than ever. To those residents who have been skeptical, who have ignored health and safety guidance, who don't think this is worth taking seriously, I ask you to please hear us. Exactly 1 week ago, Baltimore County and the state of Maryland lost Lisa Marie Alvey to this terrible virus. She's not our latest statistic. She was Spencer's wife and Kellen's mother. She was 49 years old. Lisa was a Virginia Tech graduate, a vice president at Whiting-Turner, and a pillar of her community, serving as den leader for Kellen's Cub Scout Pack and active on many boards and professional organizations, including her work with the Fort Meade Alliance to help military families through the establishment of the Fort's Resiliency Center. After fighting and beating breast cancer over the last year, she succumbed quickly to a deadly combination of pneumonia and COVID. This weekend, I had the occasion to speak with some of the people who knew her best and who loved her most deeply. The void she leaves behind, just like the void everyone we've lost leaves behind, has been immense. To those who have chosen not to take this virus seriously, put yourself in Spencer's shoes, in Kellen's shoes. Would you step in and do the right thing for your loved ones if their lives were on the line? Because their lives are on the line. Beating this virus requires us all to do our part. In Baltimore County, we have built a robust enforcement infrastructure to ensure that orders, whether state or local, are fully enforced. To date, our social distancing task force, under the leadership of Fire Director Marcus Johnson, has now conducted more than 7,000 inspections over the course of this pandemic, some of them in response to complaints, others proactive. They found more than 300 violations, and there have been 23 hearings before our liquor board to date, with another 7 still scheduled. While we do spend a lot of time doing education and outreach, including this week's partnership between the Maryland State Police and Baltimore County Police, we also cite operators who ignore the rules. We have issued fines. We have closed businesses that flout public health guidelines meant to keep people safe, and we will continue doing just that. We will continue to use the full authority granted to us by Governor Hogan's executive orders and to us by our county charter to protect our residents. And in recent weeks, we ramped up our efforts, hiring even more staff and extending our hours of operation. These rules are in place to save lives. If you are found violating them, you will be held accountable. We will not allow reckless behavior to continue without consequences. This is a matter of life and death. If too many people do not comply with the rules, we are left with no choice but to take additional actions to reduce the spread of this virus. I understand that our small businesses are struggling, but as elected leaders, our number one priority remains the health and the lives of our residents. We will do whatever it takes to slow the transmission of this virus. At the same time, as you've heard the governor say before, our federal partners have to step up. The earlier stimulus was significant, and it helped save many families and small businesses in the early months of this pandemic. But those funding streams are drying up, leaving gaping holes in the safety net our people so desperately need. Congress needs to act with urgency to support states, local governments, businesses, and communities as we continue battling this pandemic. Without it, and without Marylanders following state and local orders, we do indeed face a long, dark winter. One with rising case counts, hospitalizations, and deaths, along with a significant economic fallout and a slow, painful recovery. This, as the governor has said, is an all-hands-on-deck moment. Let's choose to band together today. This Thanksgiving, skip crowded airports and packed planes. Skip the hugs and large family gatherings now so you can have them both for years to come. Don't gather in large groups. Visit with friends and family virtually instead of in person. And please, for the love of God, please wear your mask. The end of this pandemic is coming, and that should motivate all of us even more to save lives along the way by doing our part.
Well, thank you very much, Mr. County Executive. Thank you for all that you and Chief Hyatt are doing, and thank you for joining us here today. Last month, we doubled our state relief investment to $500 million to fund a combination of new small business relief programs to protect jobs and to expand our existing successful programs in order to immediately provide additional desperately needed relief to all of the businesses and their employees who were most in need, including restaurants who have been hit particularly hard. And we included another $50 million in direct relief specifically for restaurants, which the state is distributing through our county government partners. In the spring, we took statewide action to make it easier for restaurants to adapt their operations for carryout and delivery services, including allowing for the off-site alcohol sales and delivery. And as we weather this fall's surge of the virus, I want to again strongly encourage Marylanders to support their local restaurants. With that, I'm going to turn it over to Marshall Weston, who is the President and CEO of the Restaurant Association of Maryland. I want to thank the association for all of their efforts working in partnership with us, and thank you, Marshall, for your service on our Restaurant Advisory Group, which has been providing industry-specific guidance and input for helping us to keep our restaurants safely open and operating throughout this pandemic.
Thank you, Governor. The restaurants of Maryland appreciate that you understand just how important they are to every community, and also your willingness to hear out the concerns as one of the top private sector employers in the state of Maryland. Restaurants provide an essential service and are the backbone of every community. They are dedicated to their employees by offering first jobs and careers with advancement opportunities. They're dedicated to their customers by providing exceptional dining options and service. And they're dedicated to their communities and neighborhoods by supporting local charities, youth sports teams, and local events. No neighborhood or community is complete without the restaurants that bring them all together. That is why it is so important for Marylanders to support restaurants, bars, and all small businesses during the holidays. Now more than ever, these businesses cannot be taken for granted. We need all of us to step up and buy from them over the next several weeks. Restaurants continue to be ready to provide a safe and regulated space for people to gather with friends and enjoy a meal over the holidays. We are hopeful that everyone does their part to help reduce the spread of COVID so that restaurants, bars, and other businesses can remain open and the restrictions will be lifted soon. We must all continue to wear our mask, socially distance, wash your hands, and respect the restrictions placed upon businesses. Employees are doing their very best to ensure a safe dining experience, and with everyone working together, we will remain open and ready to serve. I know we are all missing and waiting for the day when we can welcome you back to a packed dining room, to see our favorite server or bartender without their mask on, to go to a bustling bar with friends, and attend a large and lively wedding reception without these restrictions. But until that time, we must all take personal responsibility to do what is necessary to stop the spread of COVID. Not only to keep everyone safe, but to also keep our employees working and the businesses we love in every community open for business. Thank you.
Thank you. With that, we'll be happy to take some questions. Brian?
Governor, very early this morning, Executive Mark Eldridge said, time to go to phase one. You're not doing that at this point. We'll talk about why you're taking this approach as opposed to that approach.
Well, he's more than welcome to take whatever approach he wants to take. I don't think they've followed us for the past 9 months, but we're taking exactly the steps that we believe are necessary at this time.
Governor, if you could frame up for people where we're at right now. They compare it to the spring, but knowing what we know now with the test numbers that you just laid out, are we in worse shape with this right now than we were back in the spring?
In some ways, we are in worse shape in that the spike of the curve is higher than it was in some ways in the spring, that the rate of growth of our positivity rate, our transmission rate, our hospitalization rate. Where we're better off is that we have a much better understanding of how to deal with this virus. So we're keeping people alive, we're saving people, we're not losing as many folks, are not dying at the same rate. The therapeutics are better, we are getting closer on the vaccine, so I'm hopeful in one respect, but this is very scary stuff. I mean, this really is, at the beginning in the spring, everybody was just shocked by the novelty of it, and we were having announcements where we had 1 death and we had a dozen people that were infected, and it was big news. And now they seem numb to the fact that we lose, 15, 18, 24, 25 people a day, and they don't seem to care as much. But it is a very serious problem. And we're going to keep messaging to everybody to take it seriously. And the more seriously we take it, the faster we're going to be able to get it under control.
Governor Hogan, you mentioned Frederick County and that you're partnering with Baltimore County on this with the Maryland State Police. Has every county agreed to team up with the MSP for this enforcement compliance, or is it just these two counties?
I know that the superintendent has reached out to every single, not only county police chief and sheriff, but all the municipal police departments as well. And it's not just police either, but their great task force is. I was watching the news. I was telling the county exec how impressed I was. They were bringing people from the fire department to come out to talk to businesses about being safe. I mentioned it includes licensing and permit, liquor boards, whoever we can get out there to help with the case. So we're hopeful that all the counties will participate in one way or another. We will be sending additional state police to every single county.
Governor, you said that you talked to the White House today about vaccine development and disbursement. Do you have any updates for what people in Maryland can expect? And along those lines, I've heard from a number of people who are eager to pre-register already for a vaccine when it's available. Can you also let me know when they can start doing that?
Yeah, so we just got briefed. Secretary Azar and a number of the members of the team gave us kind of the latest on where they were with the vaccine. They're still hopeful, and don't quote me because I can't guarantee that these dates are going to be made, but they really are hopeful that by the end of the year, so next month sometime, and or at the latest, the very beginning of next year, that we will start to have vaccines available. They have not committed to how many, what the production is going to be, how much each state is going to get, which is why we have an approved plan that we submitted that talks about the prioritization of our most vulnerable, our folks in nursing homes, our healthcare workers, but we don't know exactly how many or exactly when. We just know as they come in, we're going to prioritize the people that need them the most.
When can people start to pre-register to get in line?
That's a good question. I don't know the answer to, but I'll make sure that our health department reaches out and gives you that answer right away because that's a great question.
Thank you. Governor Hogan, you mentioned the lab genomics test as the centerpiece of the testing strategy. The Washington Post reported that there were, in fact, bugs discovered with the first batch. Do you think that was a fraud or an error? And might it just take more instead of making lab genomics bigger?
Look, the Washington Post story was basically a regurgitation of all the other stories that we've been hearing about for 6 months. There was no news in the story. We have not had a single problem with one single lab genomics test kit. We have had enormous problems with lab capacity, with acquiring reagents and testing solutions and swabs, which we had to utilize the Defense Production Act. But, originally the FDA emergency use authorization changed. The metrics were slightly different. The tests worked fine, but the FDA changed the rules, so we immediately got the company to upgrade to even faster tests that met the new FDA guidelines, and we have used them very successfully for the past 6 months, and we plan to use every single one. And we have never had a problem with one test kit that came from Korea. We've had all kinds of challenges in testing, but this was the highlight of a success story here in Maryland.
You mentioned golf over the weekend with the president. More things are happening now. Is there going to come a time where action needs to be taken about this ending this presidency as the electoral college moves ahead and all that sort of stuff?
Well, I have confidence. Our system has worked well for a couple of hundred years. We're going to have a peaceful transition of power. Joe Biden is going to be the next president. He is the president-elect. He will be sworn in on January 20th. What happens between now and then, I believe there's going to be continuing increasing pressure on the president to make the right decision. My biggest concern, when you take away all the politics and all the spin on social media, is that we're in the middle of a deadly crisis where 260,000 Americans have died, and we're about to hit the worst peak. And the incoming administration is not even talking to or getting any information from the outgoing administration. And that is really a scary situation.
On that topic, I'm sorry.
Okay.
Did you intend?
Tom is trying to jump in front of you, but go ahead.
Did you intend for this location to be symbolic, given the Twitter back and forth in front of George Washington's speech? He resigned his commission.
I didn't quite hear about George Washington.
The location of this press conference.
Oh, yeah.
Was it intentional?
I thought it was something about what George Washington said on Twitter. The symbolism of George Washington was not something we thought about. But if you remember, back at the peak of the virus, we were holding our press conferences outdoors, and then we were holding them inside this room, which has a lot more air, and we can be a lot more spread out, which is why we are having one TV camera rather than 8 or 10. Which is why everybody's spread out and we have a limited number. But we just thought now that the virus is worse, we're going to heed our own advice and help people to be socially distanced and get the air flowing.
Okay, thank you.
I want to get back to Brad's point. What you just said, you appear to have a very good relationship with the Vice President of the United States, Mike Pence. Are you communicating directly to the Vice President those sentiments?
Yeah, I'd rather not talk in public about it. Private conversations I might have with friends, but I think the Vice President's pretty well aware of my position on the situation.
Just one last thing, but I still encounter people who say it's my right to not wear a mask. That still goes on.
Yeah.
Last time I was alive, that guy approached me out there annually to talk about that. And that's a political thing. You talk about politics, but what do you say to those pockets of resistance?
Well, it's sort of like saying I have a constitutional right to drive drunk. I have a constitutional right to not wear a seatbelt, or to yell fire in a crowded movie theater, or to not follow the speed limit. We're talking about 250,000 people dying already. More than the Korean War, the Gulf War, and the Vietnam War added together. Which part don't you understand? You wear the mask. There's no constitutional right to walk around without a mask. We did it in 1918. I don't know why we can't do it now.
I just wanted to ask a quick question about the vaccines. You mentioned your call with the White House task force. Does having 3 possible vaccines complicate how the whole plan would work? Some would be refrigerated, some have super cold.
Yeah, it is an interesting challenge, but it's good that we have multiple competing vaccines that are all getting to the finish line. So, because not one company is going to have the capability of worldwide manufacturing at the capacity we need. So having 3 at this point, potentially, big companies that can all be knocking this out. But it is a little more complicated, and we've taken that into consideration in our planning and our discussions with our state leaders at the health department and with the federal government about some need to be at extremely cold temperatures, the others don't. So we're providing for both. We're going to have to make sure, in some cases, you have to get 2 vaccines. You have to keep track of all that information, so you make sure they get the right one and who's been vaccinated with which vaccine. So it's complicated, but the good news is we're going to have more vaccines available.
Does Maryland have that cold storage capability?
We've been being involved. We have the cold storage capability, dry ice capability, and we're doing new contracts, procurement, emergency procurements with all of those things, so that we are absolutely ready the minute that we get our vaccine kits.
Thank you.
All right, thank you, everybody.
Thank you, Governor.
Wearing the damn mask, the governor kind of told us to behave when it comes to Wednesday night. Wednesday night is it's called Blackout Wednesday for a reason, because so many people would go out and get drunk and hammered, and it would be the reunions in Baltimore, and all the bars would be packed with people coming back, from college. Well, that's not going to happen, because the state police are going to be out in force with everybody that has a badge, making sure that the bars and restaurants are down to capacity, low capacity.
And that's what this was about. This was more about how we're going to enforce it with folks from Baltimore County Police, as well as Melissa Hyde, Johnny O, and Maryland State Police. Basically, how they're going to be cracking down on people who are not abiding by the rules. I think he said on Wednesday night at 5, we're all going to get an alert on our phones to remind you that, hey, this emergency order to basically be out of restaurants by 10 o'clock, to wear your mask, social distancing, just a reminder. He said it's only the second time that they've done that from the state.
And they're going to set up a phone line here. It's 833-979-2266. I think that's if you feel uncomfortable, if you're seeing something that you shouldn't be seeing, you're supposed to call that. And also there's a website too. You can also email
prevent.covid@maryland.gov. And it's basically an opportunity for you to, if you know a business, you know a restaurant, you know a gym, something that is not abiding by the rules, this is an opportunity for you to report them anonymously.
And I think Marshall Weston with the Restaurant Association of Maryland, he's just encouraging all of us, help them out. Go takeout, go delivery, and just help them out during this time. And also, he took right away, it was within 30 seconds of his mic being turned on, the governor went right after South Korea and the report from the Washington Post saying that these tests aren't working. And he said 300,000 are, and there's not one, right? Not one test that hasn't worked yet.
Not one, but he did say a lack of resources in terms of the swabs and other things necessary to process the tests and make them effective has been something that has come into play. 57% of the complaints that they've had about people not abiding by the rules has been bars and restaurants. And so that's why this task force coming out of Baltimore County, but now becoming even bigger now with the help of Maryland State Police. Wow.